So, Miss Cruz, I chose a medication called Nitrofurantoin, 100 milligrams for 5 days to treat your UTI. So you should take 1 capsule by mouth every 12 hours until the end of the treatment. It's important to finish the treatment even if you feel better just after a few days. All right. This antibiotic works for different types of bacteria and affects the organism, causing the infection by changing the mechanisms that are important for its survival, right? So, for example, one way that this medication works is by damaging the cell wall, which is that protective barrier the bacteria has. And another way that acts in damaging the bacteria is by affecting the production of important substances for the bacteria survival, like proteins. And that way, when this drug is present in low concentrations, prevents the bacteria from reproducing, from multiplying, and when it's available in high concentrations, you will cause the bacteria to die. I wanted to explain to you also how the body processes and responds to this drug. So when taken orally, this medication is absorbed into the bloodstream, right? And reaches its peak levels within 1 to 2 hours. And it is then distributed throughout the body, including in the urine, where it's going to exert its desired antibacterial effect. This drug is then eliminated from the body through the kidneys and urine. And this drug has a half-life of 20 minutes. A half-life of a drug means that it takes, the half-life of a drug means the time that takes for the amount of the medication in the blood to be reduced by 50%. That means that in this case, since it's only 20 minutes, that means a large amount of the drug is quickly eliminated from the body. And that makes it very important that you take the medication as prescribed to maintain the level that is efficient in treating your infection. In terms of contraindications, nitrofurantoin is contraindicated in children younger than 1 month, patients with kidney disease, people with anemia and vitamin B deficiency. And while this drug is very effective in treating acute UTIs, it should not be recommended for long-term treatment in patients with chronic UTIs, especially elderly patients. The reason I like to tell my patients that is because sometimes they don't finish the medication. They have a little bit of the medication at home, and they are tempted to give this medication to a family member, a friend who's having symptoms. It could be one of those patients that should not be on it. In terms of precautions, we should know, we have your medical record, but just reinforcing, please let us know that if you have kidney disease, anemia, diabetes, electrolyte imbalances, or vitamin B deficiencies, or any type of debilitating disease, because those can be a problem when taking this medication. This medication can discolor the urine, but that side effect should go away once the treatment is finished. And here's some important information that I want you to really pay attention. This drug should not be taken during the last month of pregnancy, and it should, if you're nursing, you should avoid nursing, especially infants younger than 1 month. Call the office if you're having shortness of breath, chest pain, or cough, because this drug has been associated with acute and chronic pulmonary reactions. And also call the office if you start having tingling, numbness, or weakness in your extremities, because even though it's a rare effect, adverse effect, this drug has been associated with permanent nerve damage. And my last piece of advice for you is, please read the patient information leaflet that comes with the drug and the educational material that we provide to you, because no provider can give you every possible side effect of a drug, and it is in your best interest that you educate yourself on possible side effects of the medication you're taking and when to report to the doctor.